Hi, my name is Colleen Sisk, and my project was the effects of differential reinforcement on aggression by use of functional communication training. And I'm going to preface this video with my apologies that I'm probably going to be coughing during the entire video. Just under the weather. Shane is a 5-year-old boy diagnosed with autism. Shane lives at home with his parents, his older sister, his younger brother, and the family dog. Shane was diagnosed by a licensed child psychologist who conducted the ADOS when he was 4 years old. Shane was recently enrolled in a developmental preschool program, and there were concerns regarding aggression in the classroom that led his parents to seek a diagnosis and an early intervention therapy program. Following several years of concern that were disregarded by his pediatrician per parent report. Shane now participates in one-on-one therapy. He receives home-based therapy from 12:30 to 3:30, 5 days a week. Shane's therapy was conducted in the home environment for this project as well. Shane is challenged when his baby brother or the family dog approach him. He is challenged when other people approach him with a demand, but most aggression occurs when brother or dog approach him. I think he perceives that they're going to get too close to him. They might take something that he has, or knock down a Lego tower, etc. So he uses aggression paired with verbal protest as his form of communicating for them to go away, to stop, to move, etc. I completed the intake for Shane and his family and conducted an evaluation that consisted of parent interview and observations, medical file review, previous assessments. It was determined that Shane uses aggression to escape demands or people invading his space. My behavioral definition of aggression to others is lengthy. It is hitting with an open hand or closed fist that strikes another person's body with force. Hair pulling is grasping hair on the head of another person or grasping the hair on the family dog with a fist grasp of 1 or more seconds. Kicking with foot that extends out and strikes another person's body with force. Biting is using teeth or gums to make contact with another person's body or their clothing. Scratching is using the nails of his hands to break the skin of another person. And pushing is using any part of his body to forcefully make contact with another person's body. My non-example of aggression to others is when Shane has all of his body parts to himself, or when his body parts come in contact with another person's body without force. So maybe hugging, sitting on someone's lap, dancing, etc. A frequency count was used to tally the number of times Shane acted with aggression, or he made an attempt to act with aggression each 30-minute session. And the attempts to act toward aggression were blocked by an adult. Total count IOA for acts of aggression were 97%, and total count for number of opportunities that Shane could have used functional communication training was 96%. My procedure was a single subject changing criterion design. Shane needs to learn to ask others for personal space. He needs to ask for someone to stop, for someone to move. So my phases were baseline. And intervention 1 was what we call the space card, and it's the word space printed on a neon orange oval. Intervention 2 was adding a stop card, which was the word stop on a red octagon. And intervention 3 was adding a move card, which is the word move printed on a blue rectangle. Initial baseline was taken for 5 sessions, followed by implementation of intervention number 1. During the baseline, Shane's therapist and family members were asked to resume their typical therapy session, resume normal functions just without the use of the functional communication card. Intervention. During the intervention phase, differential reinforcement of alternative behavior was used. Shane's therapist and I did 10 teaching trials of each functional communication card. It was set up that Shane's mom or the other staff would encourage the little brother to go see what Shane's doing, go see what he's playing, and they would bring him nearby, but there was enough adults to keep everybody safe at all times. If Shane attempted to use aggression, his functional communication card was available to him, and it was held out by the adult in between him and the brother, or between him and the dog. So we put it as close in proximity to him as possible, so that he would use that opposed to aggression during the teaching trials. So if he used functional communication by tapping it, taking it, touching it, saying it, he would receive reinforcement. Reinforcers were high fives, bites of fruit leather strips, always paired with verbal praise, and the removal of the little brother or removal of the dog, and getting to continue his highly reinforcing activity, which was typically Legos or manipulatives, his iPad device, etc. Once data had reached near 60 to 80%, or a steady state of responding, the next interventions were added to his repertoire. Shane's therapist and I will continue to track progress on his ability to generalize and maintain these skills, and if it drops below 80%, teaching trials will begin again. I will attach my graph to the discussion board. Excuse me. What you'll see in the graph is during baseline, Shane was successful in using his functional communication opposed to aggression an average of 4.6% of the time. During treatment 1, using DRA of the space card, Shane's percentage averaged to 36.5%. During treatment phase 2, we added the DRA of a stop card to the space card. So he had both in front of him. He could use either of them. And Shane's percentage averaged 53.5%. And during treatment phase 3, we added the DRA of move, and Shane's percentage average climbed to 83%. So that was super exciting. So once 80% was maintained, all 3 cards are left in his repertoire. They will continue to be available to him. And I will continue working with Shane, and I will continue to work with the family and the other intervention professionals. Thank you for watching, and I hope you all have a great end of your summer. Goodbye.